Because you know a good way to make someone mentally ill? Take away all their value, their respect, don't take them seriously, don't pay them, starve them, take away their basic living necessities, and watch them shrivel in shame. It's easy. It's happening everywhere.
The status quo is not only enabling a problem, it's perpetuating an epidemic, it's compounding it, and it's allowing us to stand idly by while people die. Safe consumption sites help us reduce harm, save lives, and provide referral services for those seeking assistance with their addiction. I respect the law, I respect the U.S. Attorney, but the call I fear most is the call of another family whose lives have been shattered, have been traumatized by a loss of another loved one, another person in my community who succumbed to addiction.
Her 8-year-old brother found her on the bathroom floor. She died from complications associated with using IV drugs. Had her aunt had the opportunity to go into a safe consumption space and to have a medical professional help her, she might be standing right next to me right now fighting for Ashley and Jason. In fact, I know she would be.
Let's look at the real evidence here. Over the past decade, whether it be in Canada, Germany, other European countries, these safer consumption sites have fostered better health. People get clean needles. People are observed. These are millions of injections that have occurred over this period of time, and they haven't died. For example, in Toronto, where I went to a consumption site, and it was clean, it was accessible, and there was that place where people could get treatment for their opioid addiction, but they could also have that opportunity to safely consume, to have somebody observe them for that 10 or 15 minutes when that overdose might happen.
They're a link not just to addiction treatment, but as I said, to treatment for other medical conditions, which I have seen clinically and reported in the literature as well. Safe consumption spaces present an opportunity for us to reach people who we are not reaching in the traditional healthcare system. There's an excellent study published from Massachusetts by some of my colleagues, Alex, Wally, and Mark, Rochelle, and others, showing that within our healthcare system, about 50% of overdose deaths could be prevented if we identified people with substance use disorders and sort of engaged them in care.
Incarcerate people to the point where they're not getting the help that they need and that they deserve, which is a real disservice to those individuals, to their families, and to their communities. So I had a complete 180 on how I feel about what we need to address addiction in our state and in our country, and that's where I came to really support the idea of safe consumption sites, looking at the evidence, knowing that they save lives, they increase access to treatment, and they treat people humanely because they're connecting people to the care and the services that they really need when they need it.
We've been to the State House 3 times. We've been there for safe injection sites. We've been there for methadone in the jail system. And as of September 1st, it started. You go to jail now, you don't have to suffer anymore. You don't stay awake for 90 days, tossing and turning, detoxing from methadone, which is a prescribed medication, or Suboxone. You know, it continues while you're there now. And then when you get out, the most people that die leave a prison cell within 30 days. They overdose and die.
Today is the day to start a new life. Stop drinking, stop drugging, stop having fights. My heart tells me one thing, my head another. It scared me to know my kids could lose their mother. With all the chemicals inside of my brain, it's hard to deny to feel my children's pain. To watch their mother struggling, but through the grace of God, they're still mine to keep. That's how it is.
Insight in Vancouver has had safe injection sites for 15 years and have not had one death. Not one death. So I don't understand what Governor Baker's problem is.
Having lost our children, we were on the fence because we did not understand. But they educated us, and here we are now in support.
And I see no issue with another health clinic or a syringe exchange facility acting as that safe consumption site. The negative impact just doesn't exist, and the positive impact is clear. It saves lives, and it will save hundreds of lives over the next several years.
If my son had an opportunity for a safe consumption site, he would probably be alive today.
We already have unsafe consumption sites throughout different parts of the state. People, who might be homeless or are choosing not to use it in their own home, are using on the streets, and that puts them at risk. It puts people around them at risk. By creating safe consumption sites, we're saying, you know what? We care about you. We want to treat you humanely. Here's a place where you can consume safely so that we can make sure that we can help save your life if so needed, and get you onto a path of treatment and recovery if you so choose.
If a mother had the opportunity to have her child safely inject in a sterile environment with professionals who treat them with dignity, in hopes that this is the time that they choose treatment versus finding her child dead in a bedroom or a bathroom alone, would she grab that opportunity? You better believe she would.
These facilities increase access to treatment. Governor Baker, please read your commission's report. Bring safe consumption spaces to Massachusetts and save these lives. And please do not forget about those of us that are left behind.
I've gone to wakes and funerals of friends and family members of friends, people I've known in recent years, and I don't want to go to any more.